I know it wasn't a very long time to discuss an idea, to get very in-depth, but can we have any one or two tables that would like to share their ideas? It was kind of a broad topic. Yeah, go ahead.
First, thank you. I think this has been a fabulous couple of days, and I shared that, so I'm Darla Spence-Coffey from the Council on Social Work Education. I shared that I'm not good at coming up with what I'm going to do next because I like ideas to steep for a while, but there's lots of good ideas in the brew, so to speak. But one of the things, when I heard you ask the question about what we as a group could do, a group of leaders, what I thought was that perhaps we could take a focus on wellness and think about integrating it for all subsequent topics, that the forum has actually kind of done one topic at a time and not, you know, I think we all in our own way try to figure out ways to integrate, but I think very intentionally thinking about, okay, so the next topic, whether it be on social determinants of mental health, if that's the case, or education to practice in the fall, like how can we think about wellness as we also think about education to practice?
Integrating it across. Yeah.
So at our table, we were discussing, well, by the way, a great event for the past day and a half. We were discussing the notion it should across the program, just not a one-time event that we've covered and checked the box on wellness or resiliency, but it's across the programs, and the second point, I believe healthcare organization, the employers should be working with educators. You know, there should be almost an expectation on the other side. How are you preparing our new graduates or whatever to be resilient so they do stay with the job and they're adapting to the environment? But it goes back to that transition to practice again in one of those sessions we had earlier. Thank you.
I think last table, yeah.
So we talked about how you could make that happen to drive it into our education. And the thought here was that representatives in this room actually represent a number of the accrediting agencies for health professions schools. And if we all came together and came up with a common standard that with a clear operational definition of what it means to have wellness and resiliency in our curriculum, and that operational definition is informed by employers based on the practices, that would be one thing we could do to start walking the talk or living the idea or whatever saying you'd like to embrace at this point. But that's how we can start making it real.
That's great. Liza?
A good example of great minds, shall we say. At the members meeting on health, on stress and burnout, which will probably now change to resilience, health, and well-being, one of the things we thought of doing, because it's a global representation there, many disciplines are there, we thought it would be very interesting if we created interprofessional guidelines around, just general guidelines, because they have to be adapted to different environments, but on resilience, health, and well-being, and pass it on to, I think, Barbara Brandt facilitated the environment of 24, there are about 24 accreditation commissions. So that's what we were thinking of, how to move it forward.
That's wonderful. Great ideas, actionable even for us as individuals, but as a group. So great seeds for thought. So I'll leave with one reminder that we are planning to have a dissemination event in October 25th in Irvine, California. So that will be at least a next milestone for this group that we can look forward to and more details to follow. So with that, I'm going to thank you all for being here. I'm going to hand the mic over to my co-chair, Mary Jo, but just a personal expression of gratitude for all of you who came and contributed so engaged in the topic. It's been an absolute pleasure to be here the last day and a half.
So as we draw our time together for a close, and I'll just ask if you bring up the last slides. We've talked about the fact that sometimes when there's stress and burnout, we're trying to build resiliency and well-being in organizations, the issues are so complex. And sometimes the interventions and strategies also need to be complex. But I think we've also focused on the fact that there are some things that are very much within our grasp that can be very simple. And so I want to end by sort of talking about a couple of practices that are very simple practices. And one of the things that we've talked about today throughout the last day and a half is gratitude. And gratitude has come up in many ways as a simple practice. And there actually are hundreds of studies that have been done looking at the impact of when people practice gratitude. I recently worked with a group, and we're actually doing a study on gratitude, and it looks like you're just advancing. There we go. I recently completed a study of over 700 people that actually participated in a gratitude intervention on a social network. And there were very measurable, statistically significant differences in reduction of stress and connectedness. And actually, hundreds of studies have been done on gratitude, finding it's associated with greater happiness, improved health, capacity to deal with better adversity, that people have better sleep, less depression, less fatigue, lower levels of inflammatory markers, and improved well-being and psychological adaptation overall. And one of the practices that's often talked about is the practice called 3 good things. And it's very simple. Once a day, it might be when you wake up in the morning or when you go to sleep at night, identify 3 things in your life that you're grateful for. And if you care to, even write those practices down, and then maybe once a week, look back over that list and just notice what is emerging in your life. So a simple practice of gratitude can have immeasurable benefits. And I think as leaders, we can all think about not only how do we express gratitude in our personal lives, but how do we also express that in our organizational lives. And then the other thing I wanted to close with is actually a project that really, really intrigues me called from Google. And Google was really interested in what makes the perfect team. So some of you might have heard about this experiment that Google did, the Aristotle Project. And they actually said, we know there's enormous power in groups. We know that groups can innovate faster, they find mistakes more quickly, they achieve better results, there's better job satisfaction. So Google set out on this quest to figure out what makes the perfect team. And so their long-term belief was the best teams were made by the best people, or maybe even the smartest people. And so they looked at, is that how they should build teams? And actually, this was a many million-dollar project that occurred over many years. They had statisticians, organizational psychologists, sociologists, engineers, and they looked at everything. They looked at, is it personality types? Is it the balance of gender? Is it having a combination of introverts, extroverts? Is it the educational background? Is it the managerial type? Is it that hierarchical or non-hierarchical teams are best? And they found a couple of interesting things. They found that the most productive employees would build larger networks by rotating their dining companions, and so creating a social network was important. And they also found that the best managers share traits of good communication and they avoid micromanaging. But the most profound outcome of this multi-year million-dollar project was what mattered most was kindness. And so in teams where people were kind to each other and where they kind of expressed empathy towards each other, those, in fact, were the most successful teams within Google. And I share this with you because, when I talk to organizations large and small, and they're facing sometimes great challenges of how do they acquire the budget to make these sweeping organizational changes that need to happen. And sometimes I'm working in hospitals and it's, nurses on a patient care unit and they really struggle with what can they do. And I say, when you walk out of this room, you have the capacity to make a difference because there are strategies like cultivating gratitude and cultivating kindness that can have huge impacts. So I want to thank again my co-chair Zori and Patricia and her entire team and all of you for helping to make this such a successful event. Safe travels home.